Yeah, we're good.
I'd like to call the House Health Committee to order. Will the clerk please call the roll?
Representatives Boyd, Carringer, Clemens, Faison, Farmer, Gillespie,
Here.
Hakeem,
Here.
Hawk, Helton, Hemmer, Hicks of Hawkins, Hicks of Washington, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? Okay, seeing none, I actually do have a personal order. I mentioned it on the House floor the other night, but you are missing my assistant. She's out on leave right now, Megan Dix, and she's out for a good reason. She had a little baby girl earlier this month, Amelia Catherine Dix. So congratulations to Megan. And I do want to make one announcement. I see a bunch of signs, and that's fine. I just ask that for respect to the people that are behind you, just keep the signs down so that people can see what's going on up here. And we have a pretty good track record in this committee of decorum, and I appreciate having decorum for today's meeting as well. So with that, we will go into our. We have 6 items on the calendar, and so item number 1, House Bill 7036. I believe Chairman Kumar has that. Can I get a motion? You have a motion and a second. Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. House Bill 7036 expands the ability of law enforcement in mental health capacity to be able to detain people who are in an acute crisis. Current law allows law enforcement to detain a person when they are in an immediate threat to themselves or to others. This bill changes the word immediate to imminent, and this expands the ability of law enforcement to handle these acute situations. Thank you.
Do we have any questions for the sponsor of the bill? Chairman Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. I'm curious as to the reason for the change of that word, what substantive impact that will have by changing that single word, and then also which law enforcement agency do you envision being responsible for this?
You're recognized.
Yeah. Generally, it is the first responders that are called, or a person has an acute crisis, law enforcement can be called. So those will be the people who will be at the scene. And when they detain a person, the judgment is very subjective in the sense what is immediate, what is imminent. Imminent gives them more leeway to detain a person, again, to protect themselves from harm, as well as protect the community from harm.
Chairman Clemens.
Thank you, Mr. Chairman. And as law enforcement, I assume the Sheriff's Association, the police departments, have they communicated their support or opposition to this with you?
We have not received any opposing comments. It's a very needed change, and I have not seen any negative remarks from them.
Thank you.
Okay. Any further questions for the sponsor? Okay, seeing none, we are voting on House Bill 7036. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
Thank you. That brings us to item number 2, House Bill 7004. Leader Lambert, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman, members of the committee. This is a very, very short bill that if a member of law enforcement is tasked with transporting someone for inpatient treatment, for mental health treatment, then that law enforcement agency would be notified when that individual is released from that treatment.
All right, thank you. Do we have any questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 7004. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman, members of the committee.
Thank you. That brings us to item number 3, House Bill 7008. Chairman Zachary, you have a motion and a second. You are recognized, and I believe you have an amendment.
Yes, sir. Thank you, Mr. Chairman. That is drafting code 9558.
We have a motion, a second on amendment 9558. Without objection, let's go ahead and put that on. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. Chairman Zachary, you are recognized.
Thank you, Mr. Chairman. Quickly, before I explain the bill, to speak to, I don't see Chairman Jernigan. There were a couple of questions yesterday in the subcommittee related to the bill. And so before we get off the amendment, I just want to let the subcommittee know we did make those changes. We took out the word perceived. We cleaned up the language just a little bit to provide absolute clarity. And so that was done as promised. So I just wanted to note that, Mr. Chairman. Members, what you have before you today is language that was actually brought to me by Covenant parents. The baseline of this language was actually drafted by a Covenant parent who is an attorney. And this is specifically related to duty to warn, duty to predict, duty to warn. Mr. Chairman, currently in section 33.3206, it requires a mental health practitioner to report if they are meeting with a service recipient, and if that service recipient makes a threat for bodily harm to a clearly identified victim, it then requires them to report that. The problem with this section, Mr. Chairman, is it does not make clear who they're to report to, and then it also does not take into account any general threats that are made against various groups that the medical health practitioner using, as it says in the bill, their reasonable skill, knowledge, and care. It does not require them to then report that general threat or take that next step. So what we've done with this bill is we have added that into this particular section of code. Again, this only opens up 206. This is only related to duty to predict, duty to warn. And so what this requires to be done by a mental health practitioner, in addition to notifying if there's a clearly identified victim, they also are now to report if there is an intent of actual threat against a group of people, extremely important, including but not limited to students at a daycare, school, a place of worship, or family members. And the qualified mental health care professional will use their reasonable skill, knowledge, and care that they possess to determine if that needs to be reported. If a general threat is made, we then specify within this language where that threat is to be reported. It's either reported to law enforcement, or, as stated in the amendment, if the threat is general, not imminent, or not clearly defined, they're then to report to 988 or their local crisis response service. And like for those of us in Knox County, that'd be Helen Ross McNabb, and many of you have them there in your community. So we've reached a point, Mr. Chairman, as I stated yesterday, many of us were in the meeting with the Department of Health about 6 weeks ago, where the Department of Mental Health told us that right before the pandemic, 18% of Tennesseans were in mental health crisis. Since the pandemic has ended, that number has jumped to right at 30%. So we have a significant mental health care crisis. It requires us to look at things very differently than we did just even a couple of years ago. And so revising the duty to report, duty to warn is one of those steps. And so now if a general threat is made to a mental health care practitioner, we are then requiring them to report that either to local mental health agency, or if it is an imminent threat, then they need to report that to law enforcement. And then additionally, something that was not in the bill, that mental health providers, I engaged 5 different mental health providers, large entities in this conversation. One thing that was brought up to us is there's no immunity provided for the mental health practitioner if they make that report. So we've also provided that. We've provided them civil and criminal immunity if they make that report to either law enforcement or 988 or a local agency. And last thing, Mr. Chairman, I think it's important to note, there was some question about reporting and should we just require them to report to law enforcement, which in additional sections of the code, it makes clear that you're just to report to law enforcement. The challenge we face right now, the Sheriff's Association did an informal poll back in May, and the sheriffs that they polled have not received one report from a mental health care practitioner about interaction they've had with a client about a threat. And to me, in my conversations with mental health practitioners, the reason is very simple. They do not want to engage law enforcement because they don't want to enter their client in the criminal justice system. And so what this piece of legislation does, it says you have an option. We're telling you, you dial 988 or you engage your local agency if there's a threat. They can then assess and then they can determine the next step. So with that explanation, Mr. Chairman, I'll be glad to take any questions.
Thank you for that explanation and appreciate those changes and the amendment. Chairman Clemens, you are recognized.
Thank you, Mr. Chairman. Sponsor, what if this is to be reported to the Department of Mental Health and Substance Abuse Services? Is there anything in the law that currently requires them to take action on that warning? Or is there any expectation of what they will do with that information? And then the same question with respect to local law enforcement. What are we requiring them to do with that information, if anything?
Thank you, Mr. Chairman. And Chairman Clemens, if you look at the new amendment, so I think you're looking at the old language, we clarified in the new amendment that if the threat is general, not imminent, or clearly identified, they dial 988 or their local crisis agency versus the Department of Health. It brings it back to a local level. So just to clarify that, it's no longer the Department of Mental Health. We bring that down. Those requirements are in the additional code, 207, 208, 209, 210. That is actually something that we'll want, if this body chooses to pass that, that's actually something we're going to address when we go into regular session, because there is some concern from agencies and law enforcement about the follow-up steps, because it is not clear. The Sheriff's Association, for example, we talked yesterday, there is not enough information requirement. There is not a requirement to provide the information they need to make a proper assessment. So all of that needs to be cleaned up on the back end, but all I opened was 206 just because this is a special session because of our window.
All right, you recognize.
Thank you, Mr. Chairman. And I appreciate that. And I think that's my concern. I mean, if we're really looking to protect individuals, I mean, the duty to warn is important, and getting that information to the appropriate agencies is important, but they have to be able to do something with it. They have to have the resources to properly respond. They have to have the resources to properly protect. So I don't want to leave this bill, if it's passed, just hanging on the vine. For it to be truly effective, we're going to have to follow this up with resources, with instruction, because, our law enforcement agencies and others are overwhelmed with a whole number of issues. And now we're giving them something else to respond to. And so we'd better give them the resources they need to do their job. I think to really carry out what I hear is the intention of this legislation. So I just encourage everyone in this room, anybody listening, and the sponsor let's work together to get that done if we're going to do this appropriately.
You recognize.
Thank you, Mr. Chairman. Yeah, all good points, Chairman Clemens. I'm glad this is something we can be in agreement on. So when you dial 988, and again, I'm not an expert on the procedures related to 988, but the Department of Mental Health briefed us on that. There are certain protocols and steps when 988 is initiated that they have to follow. Same thing, I can only speak to Helen Ross McNabb because that's in my community. When they are contact, there's certain protocol and steps that they take whenever a report is made. And then I talked to Sheriff Spangler, who's the sheriff of Knox County. And for them, for example, they do what they call a wellness check. They send a deputy out, they engage the Department of Mental Health, and they assess, and then they make determinations from there. So while we're not super specific in additional sections of code, each one of those entities have their own protocols that are laid out. But to your point, absolutely, I commit to this committee. There'll be additional legislation brought during session.
Chairman Clemens.
Thank you, Mr. Chairman. I just would make one more point to this, and in agreement with, I think, what is your spirit of your intention here is that there are people who don't have access to qualified mental health professionals to warn. So I again would also compel our colleagues and others, we need to do more to get people access to those mental health professionals or behavior analysts who then could warn. So I think we have a long way to go here with access to mental health care. So I would ask for everybody's help in that regard as well. Thank you, Mr. Chairman.
And before you say, to respond to that, we had some robust conversation in subcommittee on this and earlier in another committee. You know, we're 300 psychiatrists short in the state. And so this is just one piece of the puzzle. And I think pretty much across the board bipartisan, we know this is just one piece, and there are other things that we're going to have to work on when we go back into session in January. Representative King, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, a service provider, psychiatrist, whoever, if I understand correctly, looking for clarity, if they report, they have immunity, is that correct? If something happens beyond their control, if they've reported. And now if they do not report, is there any action that could take place in regards to that provider?
You're recognized.
Thank you, Mr. Chairman. So the conversation also related to this was the carrot versus the stick related to this legislation. So we obviously went with the carrot. There are certainly legal implications let me back up. This is simply conjecture. Let me make that clear. This is conjecture on my part based on conversations I have had with Covenant parents and based on the many opinions and the various news reports. So there is some conjecture related to the Covenant shooter and her interaction with mental health professionals. And so that's the genesis of this. Was that reported? Was that not reported? We still don't know. So there are legal actions being taken right now that would certainly involve the mental health practitioner. And again, whatever was or was not done. So it is my understanding that if a clearly identified threat was made to a healthcare professional and that is not reported, there are certainly legal implications that can be associated with that. But again, being not expert in that section of code, I don't want to go any further than that. But that's my understanding.
Yeah. Just,
Representative King.
thank you. Just as one follow-up. Do we, I guess, let's say an incident happens after there's been an engagement between a service provider and a client. And we find out that, well, they go into their records and say, oh yeah, we did X, Y, and Z. But in reality, they have not reported these things of this nature. But that, if you follow what I'm saying, after the fact, they're documenting that they have done these things, but in reality, they haven't. Is that a matter of, from a legal perspective, they have to be caught, so to speak, or we just take their word for it?
You recognize.
Thank you, Mr. Chairman. That representative, that starts getting deep into more what a legal proceeding would be.
Okay.
All I can go is with the language I've got right now, that if they report, then they are not held liable in any civil or criminal case. But beyond that, whether they did, they didn't, and any kind of investigation that's associated with that, I can't speak to that.
All right. Thank you, Mr. Chairman.
All right, thank you. And to follow up, I'm going to be out of order because I'm going to speak about a bill that's not before us, but it's something that will come before us in January that has to do with continuing medical education for medical providers in this. And I'll be running that for continuing medical education to what is your duty? What is your authority? What's legal? What's not legal? And so again, as pieces of the puzzle, these are things that we as a body need to address, and we need to help our providers with this. And so thank you for those questions. Chairman,
if I may just quickly, Mr. Chairman, just some other comments were made about additional steps that need to be made. We had this conversation, a very passionate conversation yesterday in subcommittee. I think I'll call a name, Chairman Williams just presented a bill that passed out of insurance that is critically important to anything that we're discussing related to mental health. And so you talk to Covenant, UT Medical, Helen Ross McNabb, Children's Hospital, all those. We actually had many of those providers up here a couple of weeks ago in a meeting asking questions about where we stand, what steps we could take. Each one of them said we have a crisis in funding. So that's where we are right now, related to mental health, related to the reimbursements that are extremely low. We have significant staffing shortages. There are many in our community, my community in particular, and Representative Carringer. We have Peninsula in Knox County, and they're losing $1 million a month, and they may not make it through the end of the year if we don't take certain steps. And that's just one community, and that's just mine. And so, while everything we're talking about, this is extremely important, this will save lives without question, we have to address the funding aspect, which Chairman Williams is working on. Says we're talking about this, and you'll have other bills. Again, this is just one piece, but that bill that passed out is one of the most critically important pieces of legislation that we can look at going forward. And I would encourage our colleagues in the upper chamber to reevaluate as they look at various bills. This is one of the most important things that we could do, because it has an impact from Memphis to Mountain City, and it will significantly increase the mental health capacity and providers, the providers' capabilities that they have moving forward for all Tennesseans.
Thank you. Chairman Williams, you are next on our list.
Thank you. I don't know how to respond to that, Chairman Zachary, but I appreciate it. And for the record, the rules weren't violated. Even though he said my name, I was next on the list. But I wanted to commend you for this bill. I think one of some of the challenges in subcommittee that we discussed were that there was a fear that if we did reporting of this nature, that it would overwhelm an already overwhelmed system. I think that is a problem that we try to face as it relates to the funding and not to the mental health component, which is occupied in your bill. I think your bill is great in that it gives, particularly with the amendatory changes, it gives practitioners across our state kind of an intermediary step to be able to notify someone in mental health, so that when something happens or something said that reaches a certain level of concern, that they're able to report to them and not to a law enforcement agency who's not necessarily trained to make sure that's the case. Because when I talk to law enforcement agencies, very rarely do they get calls from clinicians or therapists who are concerned about the mental health of their patients. Generally speaking, I think that those practitioners don't want to call law enforcement, but they may feel more apt to call a mental health, someone at the Department of Mental Health, which I think is a great intermediary step. This special session is not a this or that. It's a all as it relates to mental health, and so hopefully we can provide additional tools to our providers while providing them the funding they need to keep the doors open so that people can get the services they need. And so I appreciate you bringing this bill. It is a very important part of the overall mental health of our state, and look forward to supporting it. Thank you.
Thank you. Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you, Chairman Zachary, for bringing this up. It's really a very important step towards enhancing our ability to detect incipient and hidden threats. And I think we will be early and better informed to prevent tragedies from happening. Although it does increase our ability to detect those things and duty to report is important, I really didn't get a clear sense what happens in case of failure to report.
Thank you, Mr. Chairman. If they fail to report and God forbid something terrible happens, then that would be up to the legal process and whatever current liability they have. Again, that the liability is there now. And so versus in this short window, looking at penalties for not reporting, the decision was made to provide them an incentive to report versus just some real concerns mental health care providers had about providing the stick option, moving forward with that and trying to work through that during a special session. It was just not something feasible. But in 7, 8, and 9, there are additional 7, 8, and 9 deal more with reporting and what happens when you report, who you report to. Those are additional sections of code. So all I've opened is 206 that just simply relates to the duty to warn and report.
You're recognized.
Well, thank you. I can understand the concern and compassion that mental health workers have for their patients and for their hesitation at times to turn somebody in. Yeah, I can understand that, and that empathy has to be respected. My other question was that how are we going to inform the professionals, mental health professionals, about passage of this bill, as well as, I think importantly, the immunity that they will receive? How are we going to communicate to them? Thank you.
Recognize.
Thank you, Mr. Chairman. Well, it's important doing what we're doing today. Hopefully, as this bill moves through, it passes the House, and maybe our colleagues in the Senate will choose to pick this up, and it passes, and it brings attention to the issue. And then working with the mental health providers, they have, just like any other law that we pass, they will then pass that down, and the clinics will then inform the mental health practitioners themselves of this new law and the requirement.
Thank you. Thank you, Mr. Chairman.
Oh, thank you. Representative Hemmer, you're recognized.
Thank you, Mr. Chairman. Thank you, sponsor. I had a question around the new, I guess, standard here around if the threat is general and not imminent or clearly identified, 988 or local crisis response service will be called. What being this is so new, I mean, what impact will this have on the 988 volume? Has that been estimated?
You're recognized.
Thank you, Mr. Chairman. Well, unfortunately, Representative, based on the fact that according to that informal survey the Sheriff Association did, they have had no reports, no mental health practitioners are reporting. So it's tough to know what that call volume will be. But my hope would be that as this becomes law and awareness is brought to this, it will increase the calls into 988, but there were no concerns brought up about the ability for 988 to be able to handle additional calls. Because again, we're going from, in the last 2.5 years in Tennessee, we've gone from 18% of Tennesseans in mental health crisis to 30%. So it's growing significantly. And so if we can have a few mental health practitioners engaging 988 or their local, and let me back up too, the mental health practitioners that I talked to in Knox County, they would call Helen Ross McNabb. They would call the local agency. Most of them would not even dial 988. It would probably be your more rural communities that would utilize 988. But in terms of the volume, that has not been brought up as a concern.
Thank you. Anybody else have any questions?
Yes.
Oh, Hemmer, you're recognized.
Thank you, Mr. Chairman. Appreciate the comments. And that's kind of one of my thoughts. I'm glad the chairman brought it up in terms of the medical education. We're kind of creating a new category in this general non-imminent threat for providers to essentially make a judgment call. So making sure, they're aware and have training so we can figure out what those categories, what that judgment needs to be, putting them in this, very, very serious position to report these on their clients, essentially. Thank you.
Thank you. Okay. Any?
Just thank you, Chairman. Just one final comment to Representative Hemmer, to Representative Chairman Kumar, who made those comments. Again, and I think I said this, but just to reiterate, mental health care practitioners have told me that the hesitancy to report, duty to report now, or any issue is they want to keep their patient out of the law enforcement system. Giving them the option to dial 988 or calling Helen Ross McNabb or calling their local agency should increase volume and provide them a comfort level where they turn it over. They're then allowing that evaluation to take place by an additional mental health care provider or professional. They then make the determination if law enforcement needs to be engaged, because we were briefed on 988, how it's that first call. Then they take the step with the individual. Then they determine if they engage law enforcement or not. So our hope is, because now no one is warning or reporting, according to an informal survey, our hope is with giving them the option to keep their clients out of the criminal justice system, it will provide them a comfort level to report, which will then hopefully eliminate future threats and make Tennessee safer.
Thank you. Seeing no further questions, we will be voting on House Bill 7008 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to count and rules.
Thank you, Mr. Chairman and committee.
Thank you. That brings us to item number 4, House Bill 7006. Chairman Sapicki, you are recognized. You have a motion, a second.
Okay, Mr. Chairman.
You're recognized.
Members, I bring you a bill from the Department of Mental Health and Substance Abuse. It's very simple. What it does is if there's appropriations made by the General Assembly or the governor, it allows the Department of Mental Health and Substance Abuse Services may direct available state funds to contract with additional private service providers across the state to provide inpatient psychiatric services for uninsured individuals in this state. It also, on or before December 31st of 2024, the department shall submit a report to the Speaker of the Senate and the Speaker of the House of Representatives on whether additional inpatient psychiatric services are needed in the city of Knoxville, Tennessee. The report must include recommendations on whether additional state funds should be expended for the construction of a state-owned and operated inpatient psychiatric facility in the city of Knoxville. Members, that's what it does, Mr. Chairman.
Okay. Any questions for the sponsor of the bill? Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. I have a couple of questions. Why are we specifying Knoxville, Tennessee here as opposed to everybody else?
You're recognized.
From what I've been told by the department, they are addressing the needs there for psychiatric care.
Chairman Clemens.
So is there some insinuation that this is only a Knoxville problem, or is that just what they told you?
You're recognized.
I'd be speaking for the department on that, but I believe what their intent is they've identified a basic need immediately in Knoxville and are trying to address that to see if a study is needed to bring the information back to verify that. And I'm assuming if the information come back and says no, they will look elsewhere in the state of Tennessee to try to fill the gaps.
I think, let me interject on there. My understanding is that the department is already doing some of this in East Tennessee. And so because they're already doing some of this in East Tennessee, then that would be the location. And so that may be why they're specifically on this report for Knoxville. Okay. Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. And then the next question is, we're here again directing state funds and taxpayer dollars to private entities. Are the usual rules with regards to private contracts going to apply to these funds?
You recognize.
Yes, sir.
Chairman Clemens, you recognize.
Thank you. And I'm concerned, and I openly admit this is more of a question for the Finance Committee, but the fiscal note on this is pretty vague, and it's one of the first I've ever seen that has a definite fiscal note, but it doesn't actually put an estimated dollar figure on it. And again, I'm a big believer in finance and the appropriate committees discussing that issue, but I can't help but point out that we're talking about providing inpatient psychiatric services for uninsured individuals. You know, when we have the opportunity to expand Medicaid and cover all these individuals, which is free money from the federal government, that now we're asking for the state to pony up more money to private companies. So I'm going to make that point, but I do have a lot of questions about the actual cost of this and making sure those dollars are tracked appropriately for the purpose stated. Thank you.
All right. Thank you. No, you're good. Okay. Representative King, you're recognized.
Thank you, Mr. Chairman. My questions have been asked.
Okay. Thank you. Any further questions for the sponsor? Okay. Seeing none, we are voting on House Bill 7006. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman.
That brings us to item number 5, House Joint Resolution 7016. Representative Hemmer, you are recognized.
Thank you, Mr. Chairman. I'm going to be taking
Your
this off
motion.
notice, and thank you for the opportunity to speak on it in subcommittee and your support and willing to send a letter. I've had really good conversations with TennCare as well as Department of Education, and they're going to be looking over all these grants. Found out about these programs this summer when I was preparing for special session, spoke with some senior HHS officials, notified me they sent all 50 governors a list of a number of grants that have been, they're new and are available out to the communities, and that mostly at Tennessee are not taking advantage of around mental health, communities affected by gun violence. And these are some really, really good things. Some of them around school-based providers that Medicaid's pay for, as well as mental health practitioners in schools. And so it's a lot of great things that we're not taking advantage of right now. So I appreciate the department's willingness and the chairman's support to finding out what would work for Tennessee. So thank you.
All right, thank you. So, and per the representative, I will be sending a letter, and it's a bipartisan letter, to the Department of Education and TennCare. And so hopefully they will have that response when they come back in January to give us information on this. So without objection, House Joint Resolution 7016 is off notice. That brings us to item number 6, House Joint Resolution 7022. Representative Hammer, you're recognized.
Thank you, Mr. Chairman. I'm going to be taking this bill off notice too. This bill is around creating the 988 Partner Toolkit, and in conversations with the Department of Mental Health and their communications director, they are doing a lot of the things in the toolkit already and willing to take a look at the things they aren't doing today. So appreciate their willingness to work and help further promote the 988 line that is doing such great work in our state and across the country.
Thank you. And as per the previous bill, I have a commitment from Mental Health and Substance Abuse. When they come back to us in January, they will provide us more information on this as well. So without objection, House Joint Resolution 7022 is off notice. That okay, brings us to the end. Representative King, you're recognized.
Yeah, thank you, Mr. Chairman. I just going back to House Bill 7006, I did get a text from what I consider a reliable source in Chattanooga that what is being proposed in Knoxville would be of assistance to the number of people who have to be served in East Tennessee. Is all at this time flowing in the direction of Chattanooga, and this would lessen the burden on the efforts to serve people adequately. Thank you, Mr. Chairman.
Thank you. All right, so I do want to make a few comments. I'd like to thank all those in the audience coming up here and doing your rights, and sitting in on and being part of the Republic, and I appreciate that. Appreciate the decorum, and without objection, we are going to adjourn subject to the call of the chair.